Hi, you guys. Welcome back to our daily practice questions. It is day 120, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 72-year-old patient sees a nurse practitioner for hypertension management in a primary care clinic. Which part of Medicare typically covers this service? Is it Medicare A? Is it Medicare Part B? Is it Medicare Part C? Or is it Medicare Part D? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which part of Medicare typically covers this service? So what services are we talking about? So we have a 72-year-old patient who sees a nurse practitioner for hypertension management in a primary care clinic. Y'all, the best answer is B. Remember that Medicare Part B covers your typical outpatient needs. All right, question number two. A patient is admitted to the hospital for acute heart failure treatment. Which part of Medicare generally covers inpatient hospital processes? Is it A, Medicare Part A? Is it B, Medicare Part B? Is it C, Medicare Part C? Or is it D, Medicare Part D? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, which part of Medicare generally covers inpatient hospital services? All right, and see, this stem of the question tells you everything you need to know about this. It's asking which part of Medicare covers your inpatient needs, right? And y'all, that is Medicare Part A. Remember, I say think Medicare Part A, so A for automatic. This is the automatic one that you receive once you're 65, or if you have end-stage renal disease, or if you are deemed disabled. You will get Medicare Part A automatically, and that's covering your basic needs and inpatient needs, okay? Then again, like question one, Medicare Part B covers those basic outpatient needs. So your DME equipment, your labs, your outpatient appointments, all right? All right, and lastly, question number three. Which part of Medicare typically covers outpatient prescription drugs like antihypertensives and statins? Is it A, Medicare Part A? Is it B, Medicare Part B? Is it C, Medicare Part C? Or is it D, Medicare Part D? Take a moment and tell me what you got in the comments, y'all. All right, and in this scenario, the stem is the question. The question is the stem. So it states which part of Medicare typically covers outpatient prescription drugs. So, y'all, that's all you need to know right there. Remember, D for drugs. Medicare Part D covers your prescription medication. And then the only one that we didn't cover in these questions is Part C. And remember, Part C is your choice plan. So you have the choice of adding Part C if you want to add vision and dental coverage. And y'all know my soapbox. I don't even understand why that's a choice. I feel as though that should be included in the automatic coverage, because if you're 65 or older, typically this population predominantly are going to need vision and dental coverage. So I don't even understand, but hey, that's just me. But all right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number, or shoot us an email to thenursingstudio, the number one, @gmail.com. Everything that I do offer is linked in the bio of this channel. And if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.